So for McConnell taping, right, basically what you're going to do is you're going to split the patella up into two pieces, okay? One at the top, one at the bottom. And I'm just measuring roughly. What I'm looking to do is, here's the kneecap. I'm splitting it in half. The top half of the bottom piece is going to go there, and then the next piece is going to go up here to cover the whole kneecap. You can just mimic the length. This is called leukotape. So this is cover roll here, and this is leukotape. The leukotape attaches here. This attaches to your skin. This stuff is super sticky, so the goal is always not to let it stick on itself. So all I'm doing is just attaching that right over the knee. So now, like, I have the whole knee encompassed here. Okay. Now the leukotape, I'm going to do 3 different straps. And what I'm trying to do is glide, slide, and rotate the kneecap from out to in and then up. Okay. So essentially going to shorten this muscle and put it at a more efficient level, right? And then kind of give a small stretch. So you may feel some pain on the outside part from a stretch, and you may feel some pain on the inside part because of a compression.
Okay.
That's totally normal. Again, if it becomes uncomfortable, just take it off. It shouldn't be, then it means I put it too tight, but
okay.
It shouldn't be that. We're just gonna lay this down on it. So the first one you pull across, so you go from the outside part of the kneecap, you just measure from there, and on the inside here. The next one goes bottom to top on an angle. And the last one goes from the middle of the kneecap out to the side. It's the shortest of the pieces. So from the dead center, I'm going to glide your kneecap over. Now because I'm gliding, I don't need to go super hard with the tape because my finger's doing the glide. So the key is just to let it lie over. Okay? That way, because if you notice, if you pull it way over, you'll start to pull up the tape as well. Here, again, I go on like an angle. I'm pushing you over, okay? And what I'm doing is just pulling to this medial side and then up. So I'm pulling this way and then over. So if you can see, it's kind of like curving a little. So it has to help with some of that rotation. And then the last is for the tilt. So here's the kneecap here. Halfway through, I go right on top of it. I pull down, and then this one I do give a little bit of force. So I pull down on that guy, like that. So essentially what you're doing, that first piece of tape, glided the kneecap this way, medially, so laterally, medially. This one, turned it and rotated up, okay? And then the last one tilted and turned you this way. That's the ideal position. Then if we did it right, when you bend your knee, it should hold nice like that. Good. Nice, and you should have freedom of motion. Cool?
Mm-hmm.
Nice. McConnell Taping.